Teresa came to us because of a very complex set of problems, primarily related to the fact that she was having increasing headaches and losing vision. And part of the evaluation made us look at blood vessels that go to the brain, and that's how we discovered the fact that she had a fairly large, complex brain aneurysm.
When I found out I had an aneurysm, at first I was a little nervous. It was very scary to be in the position of not knowing, wondering, if everything would be okay, would life go on as normal.
We took the anatomy of Teresa based on her angiograms and CT angiograms. When printed through the Stratasys 3D printer, allowed us to generate an entire replica of her entire brain blood vessel anatomy.
And when you print out these models and they try to mimic a vascular feel, the materials and how we use it, it really allows us to create a lifelike environment that I don't think is really achievable any other way. 3D printing is creating a whole different way to do that.
Being able to plan complex procedures with a team, because right now we prepare for complications on a theoretical basis. We often, many times, despite the best theoretical planning, we are faced with circumstances where we don't know what to do.
So originally our plan was to treat her aneurysm with a metallic basket called the Webb device that we would deliver into the aneurysm using a tiny tube. What we were able to do in this case, take a tube and try to deploy that Webb device, and wasn't going to work.
If you could operate on the person before you operated on them, how would that device feel? Would you use a different device? Would you not treat the patient? Would you now treat the patient differently?
I think it's wonderful to be able to practice, just to know what you're doing beforehand.
And so, based on the Stratasys 3D model, we were able to preempt potential complications and devise a much more optimal means of treating Teresa's aneurysm.
We took something that could potentially have been bad and made it a good experience.